QRSQuantronResonanceSystems.com.
Dr. Pollack has 15 years of experience as a board-certified family practitioner in both Canada and the U.S. Of course, of those 15 years, he used magnetics as a treatment option for 10 years with his patients. Additionally, Dr. Pollack has been trained in the following areas: acupuncture, homeopathy, nutritional medicine, and various forms of bodywork. The positions he currently holds are the Medical Director of Amerigroup, New Jersey, Associate Professor at Johns Hopkins University, and President of the Advanced Magnetic Research Center in Delaware Valley. Through his book, Magnetic Field Therapy in Eastern Europe, a review of 30 years of research, Dr. Pollack has provided an important contribution for furthering the education of magnetism to clinicians in the United States. The book contains a synopsis of over 340 studies translated from Eastern Europe and was co-authored by Dr. Jerovic, M.D., Ph.D., and former director of the National Institute of Public Health in the Czech Republic. Dr. Pollack, M.D., is considered the #1 medical authority of magnetics in the U.S. and is frequently requested as an authority for radio, television, printed press, and conventions, as well as teaching in hospital and university settings. I am now honored to introduce Dr. William Pollack.
Hello.
Hi.
All right, are we on?
Yes, we are.
All right, great, thank you. Good evening, everybody. We want to change the format slightly this evening. I'm going to just talk a little bit about a couple of studies that have been done, or at least one study that was done, and then just review for everybody the primary actions of magnetic fields. And then we're going to spend most of the evening actually doing Q&A. If we find gaps in the Q&A, then I can go off on a tangent, and those who've been on the call before know that I can do that well. So the first thing I'd like to bring to your attention this evening is a recent study we became aware of with the QRS, looking at vascular dilatation, the opening of blood vessels. This is a study that was done using the QRS on retinal blood vessels. We know that one of the primary actions of magnetic fields is to dilate blood vessels, and the retinal vessels are easy to study. And so this is one of the things that people did in order to look at the physiologic response of the QRS. Before that study was done, what the researchers had done is actually to evaluate the literature on the effects of magnetic fields in ophthalmology or on the eye, particularly extremely low frequency fields and low strength fields. And what they found in a review is that there is an improvement in the epithelialization of the cornea. What that means is that if you have a corneal injury of some kind, an ulcer or a scratch, irritation, anything or a foreign body that creates an injury to the cornea, you can have this repaired very rapidly with magnetic fields. Now, normally the cornea heals very rapidly anyway. It's one of the fastest regenerating tissues in the body. And a scratch on the cornea can heal overnight. But sometimes the injuries are deeper, and they can take days to heal, plus they have the risk of infection. So if you expose the cornea to a magnetic field, say the pillow from the QRS with an injury, you would get that to heal faster. The blood vessels of the retina have been found in other research to be dilated. And the magnetic fields tend to produce a low intraocular pressure. In some cases, resistance is decreased, and any blocked blood supply in the eye begins to get set into motion. In other words, the blood vessels are dilated, and any blocked circulation is improved. People have also found that where there is significant pain in the eye from glaucoma, from an injury to the eye, even potentially in somebody who has lost their eye, you can decrease the pain in that area, just like you can pain anywhere else in the body. Hematomas, in other words, blood leaking into the background of the eye, which can be a disaster for vision, sometimes are able to be resorbed faster using magnetic fields, particularly pulse magnetic fields. I have tried static magnetic fields for this purpose, and even to be able to draw any hemoglobin or any iron-bearing hemoglobin to the sides of the visual field, but they didn't seem to work very well. However, the research is showing that pulse magnetic fields seem to help the body to clear any blood loss or blood into the background of the eye, the vitreous, faster. In glaucoma is actually improved about 50% of the time, even where medication is not effective. And there are circumstances where medication doesn't work very well in glaucoma. So using the combination of the magnetic field and medication can produce an increased response. And of course, even without medication, you can produce an increased response. What we don't know, and remains to be seen, is that whether regular use of the QRS, as we normally recommend it twice a day, would actually decrease the development of glaucoma. One group of individuals that we strongly recommend the use of magnetic fields for are diabetics. And as you know, diabetics gradually develop retinopathy, but diabetics also have a very high incidence of glaucoma, higher than the average in the population. So again, preventive maintenance with magnetic fields in diabetics could actually potentially even prevent glaucoma. There have been no recorded side effects of the use of low-frequency fields, either on the eye or on the brain. When this study was conducted, they looked at different field strengths of the QRS on the blood flow using Doppler flow technology, using ultrasound duplex technology. What they actually found is that the blood flow could go up as high as 40% from the base. With a QRS setting of 2, you would get about a 10% increase. At a QRS setting of 4, you would get about a 20% increase. And so on. So for each increment of 2 on the QRS, you will get about another 5% increase. So by the time you reach 8, a setting of 8, you can have a 40% increase in the vascular flow in the back of the eye. Again, the primary benefit of this would be to actually be able to demonstrate that the higher the setting, generally speaking, the greater the vasodilatation in the body. So that's not just limited to the eye, obviously, it's anywhere in the body. This is a really nice study. It's very objective. It's not subject to individual variation. There was a period of measurement prior to using the field. And in fact, actually, it was compared to the use of nitroglycerin. Nitroglycerin is a potent vasodilator. When the magnetic fields were compared to nitroglycerin produced a stronger response by about 2 to 3%. Only about 2 to 3% using the highest setting of the QRS. In other words, in this study at the setting of 8. So the QRS response with a vasodilatation is just about the same, almost the same as it is with a dose of nitroglycerin. The other study I want to talk about, and I think I might have mentioned this before, so if you've heard it before, bear with me. There was a placebo-controlled trial using the QRS in 71 elderly individuals with osteoarthritis of the knee. And this was conducted in a teaching hospital, tertiary care medical center in Slovakia. And they used various physical measures, including pain, general health, some laboratory parameters, and a functional mobility test of the knee joints themselves. So 35 people were actually put on the QRS, and 36 received placebo. And they were about equally divided, male and female, and they were exposed for 16 minutes to the field. What they did is to gradually increase the field strength from about level 2, step 2, up to about step 8 over the first 4 weeks of therapy. And then the individuals remained on the therapy for another 4 weeks at level 8 for a total of 8 weeks of therapy. So again, the first 4 weeks they stepped up gradually from 2 to 8 and then maintained themselves on level 8 for another 4 weeks. The outcome measures were all conducted at the end of the study. Basically what they found was that subjective measurements of pain and the general condition of health compared to the sham treatment or the placebo treatment was highly statistically significant. The patients sensation of pain with their arthritis decreased dramatically. And their affective verbal rating scales and global subjective scoring also were also statistically very significant, highly significant, at the level of 0.02 or lower, in fact. For laboratory examination, the P fibrinogen level showed a trend towards reduction compared to placebo, but it was not statistically significant. So clinically,